Are they overworking you inside there, man?
No, I work down at work the bed.
It's bad?
It's not as bad as you think.
It's not as bad as I think?
Yeah. It's strange. I don't want to say one way or another tonight.
But I see on TV that, it's chaos.
Everything you see on TV, someone paid for.
I'm going to switch it off. Because I come here and everything is normal.
I run the trauma center down at Kings County, and the deaths that we're seeing, everybody who dies has coronavirus on their death certificate. Everybody who ends up having anything going on has coronavirus on their death certificate. And we're bringing in a bunch of people from out of town. We get doctors coming in from Nebraska who don't know what the hell they're doing. A lot of people die because of it. I don't know if it's coronavirus or if it's just a breakdown of the health system and we finally scared ourselves some shitless. It's very bizarre and I don't want to comment on it.
Man, keep yourself safe. You sound like you have a good head.
You have a good head too. God be with you.
The numbers?
Very much so.
How do you know?
Because I work in the emergency room. I see it.
What are they doing?
Anybody who comes with a respiratory issue, they don't test them, they say positive COVID. I'm working in the emergency. They talk about the front line like I'm literally in the front lines. I'm seeing it. I worked 13-hour shift yesterday. The numbers are not coming out the way they're saying them.
So if people are dying with something else, are they treating it just as COVID?
People die all the time. But now somebody dies of a respiratory issue and they didn't test them with COVID. They're saying COVID. They put it on their death certificate, which is bullshit because I'm the one saying like they didn't even test with COVID. So yes, they're hyping the numbers up. Easily to hype them up.
Are the hospitals more busy?
Excuse me?
Is the hospital more busy?
No, it's less busy, but they're paying more for COVID patients. So the federal government, as you know, a lot of people know, they're paying for the COVID intubated patients and the people that are just getting treated. So they're getting more money for those than getting regular patients, Medi-Cal, Medicare. That's what's happening.
Thank you.
To me, all you're doing is you're padding statistics. You're putting people on that have COVID-19. If they didn't have it, you're making the death rate for New York City a lot higher than it should be.
To be honest with you, all of the death certificates they're writing COVID on all the death certificates, whether they had a positive test, whether they didn't. So I think, again, this is my personal opinion. I think like the mayor of our city, they're looking for federal funding, and the more they put COVID on the death certificate, the more they can ask for federal funds. So I think it's political.
I had one that was autopsy because it was furious. And apparently, and I don't know who the Supreme Court Justice is, but the Supreme Court Justice was related to this family. And because I know my sister died of COVID-19, she said she had Alzheimer's and they didn't suction her. You have to suction because they forget how to swallow. And right away they stamped COVID-19 on her death certificate, and this Supreme Court Justice, whoever it is, back to the hospital, they did an independent autopsy, bingo, no COVID-19.
We know there are many unanswered questions during this pandemic. We've been out in the street, talking to some folks who are on the front lines, talking to the unsung heroes of the people of New York City, people, for example, in funeral homes. And we've talked to these unsung heroes, and we've discovered some troubling things, some things that should disturb us. This will just be part one of an ongoing investigation into fraud, waste, abuse, corruption, and COVID.
Part of the issue, for instance, in the United States, if you're a hospital seeing a patient with COVID and Medicare, the over 65, you get paid a 20% bonus on the case relative to if you're not seeing a non-COVID case. So there's strong incentives to over-report in some settings.
Something which I didn't anticipate, but I heard this from doctors in the United States, is that there are actually good reasons there to say that somebody died of COVID rather than say of cancer or a heart attack. And basically, the reimbursement that a hospital gets for a patient if you have a patient who basically has pneumonia, which is very similar to the way you die in COVID, and you say they died of pneumonia, you get much less of it than if you say they died from COVID. And apparently, if you also put that person on a vent, you even get an extra money for that. But it goes much beyond the United States. I think everywhere they've tried to emphasize number of deaths. They often mention the pre-existing conditions, but in Israel, the median age of people dying is over 85. In fact, everywhere in Europe it's 85, because if half the deaths are over 85, then by definition the median is 85. And these are people who have other conditions as well. So instead of emphasizing that these are deaths which are probably natural deaths, they decided to rather emphasize the COVIDness of their deaths.
Some added information if it helps them in making their decision.
But we're hearing now tonight there's more scrutiny about just what qualifies as a COVID-19 death as we have passed another very difficult milestone.
Well, last month, the CDC released figures showing the vast majority of people who were listed as dying from COVID-19, 94% of them had other morbidity conditions, on average 2 to 3 other potential causes of death. Now we have numbers from Milwaukee County that may be even more startling. As of this past Sunday, 410 out of the 422 deaths there attributed to COVID-19 occurred in patients with other underlying potentially deadly health conditions. That's 97% suffering from diabetes, heart disease, leukemia, colon and prostate cancer, and more. Most had 2 to 3 conditions. Some had 5 or 6 serious illnesses, but all of them were listed as COVID-19 deaths. Even if they weren't tested for the coronavirus, if they had symptoms, that was their listed cause of death. And COVID was never named a secondary cause or cause other. It was always the primary cause. Here's one example. Cause A, coronavirus. Cause other, heart failure, diabetes, Parkinson's, cardiovascular disease, renal failure. Remember, that's one patient. But in Milwaukee, per the medical examiner, every person who dies with COVID-19 dies from COVID-19, no matter how sick they already were. Shannon?
Rick, did you say people who weren't even tested for COVID-19 had that listed as their cause of death?
If the doctors thought they had symptoms of COVID, they listed COVID as the cause of death.
Okay, very interesting report, Rick. Thank you very much for digging into that.
So something that would be helpful just to add from an informational level is when reporting sort of COVID cases, to separate out diagnosed with COVID versus had COVID-like symptoms.
Yes.
Because the list of symptoms that could be COVID at this point is like a mile long. So it's like hard to, if you're ill at all, it's like it could be COVID. So just to give people better information. Definitely diagnosed with COVID or had COVID-like symptoms. We're conflating those two so that it looks bigger than it is. Then if somebody dies, was COVID a primary cause of the death or not? If somebody has COVID, gets eaten by a shark, we find their arm has COVID, it's going to get recorded as a COVID death.
Is that real?
Basically.
Not that bad, but heart attacks, strokes.
You get hit by a bus.
Cancer.
If you get hit by a bus, go to the hospital and die, and they find that you have COVID, you will be recorded as a COVID death.
Why would they do that, though?
Well, right now, the road to hell is paved with good intentions. I mean, it's mostly paved with bad intentions, but there's some good intention paving stones in there too. And the stimulus bill that was intended to help with the hospitals that were being overrun with COVID patients created an incentive to record something as COVID that is difficult to say no to, especially if your hospital is going bankrupt for lack of other patients. So the hospitals are in a bind right now. There's a bunch of hospitals they're furloughing doctors, as you were mentioning. If your hospital's half full, it's hard to make ends meet. So now you've got if I just check this box, I get $8,000. Put them on a ventilator for 5 minutes, I get $39,000. Or I got to fire some doctors. So this is a tough moral quandary. It's like what you can do. That's the situation we have.
Ugh.
America's top infectious disease expert says the official death count for COVID-19 is almost certainly too low. Yet there are also concerns about overcounting cases, including the concerns of a coroner in Colorado. The coroner says he has documentation to back up his claim, which means our investigative reporter Chris Vanderveen has it too.
Nowhere on the man's death certificate will you find the words COVID or virus. Instead, the coroner concluded the death was the result of ethanol toxicity.
For the layperson, what is that?
That's alcohol overdose, basically.
Montezuma County Coroner George Devers found a blood alcohol content of 550.4 milligrams per deciliter.
Yes, it's very, very high.
Anything over 300, he says, can be fatal. Even though the man technically had COVID, he says he is 99.9% sure alcohol killed the 35-year-old, which is why he remains stunned at the fact that even now the state health department has the death listed here.
They listed it as a COVID death.
Yes, the third COVID death in a county that sits at the very corner of southwestern Colorado. Which brings up another point. The very day the man's body turned up in a park in the middle of Cortez, Montezuma County commissioners sent this request to the state asking to open up businesses in a limited way, citing only 16 positive cases in the county. Monday, the state health department denied the request, saying it still has some concerns about vulnerabilities. Today, the county commissioners let out their frustrations in a meeting posted to YouTube.
I mean, the state can't get away with that. They can't get away with calling something a COVID death when it isn't a COVID death.
As for Devers, he'd like a better explanation from the state.
I called again this morning, left another message, and I've yet to hear from him.
He just wants someone, anyone, to hear him out.
It'd probably be a good place for them to start, just at least call you back.
I would think so. I would think so.
Within the hour, the state health department got back to us saying that the variance wasn't officially denied. It was returned with feedback for revision. CDPHE also said that it classifies a death as COVID-19 when there is a positive test and then someone dies. That raises a ton of obvious questions, like what if somebody tests positive for COVID and then falls off a balcony or get hit by a bus, you know? We will continue to ask these questions.
Good evening. I'm Luann Sorrell. We start with big breaking news tonight. Fox 35 questioning the coronavirus numbers and uncovering a shocking revelation. A man dies in a motorcycle crash, but his death listed as a coronavirus death.
Fox 35 News investigating. We dug through the data, and then we asked the questions. Fox 35's Danielle Lama joins us live from Orange County tonight. Danielle, how are officials explaining this?
Well, Charles, they really haven't given us much of an explanation at this point. The way we found out is I was asking the county health officer about 2 coronavirus deaths involving people in their 20s and whether they had any underlying conditions. Then one of his answers surprised us.
The first one didn't have any. He died in a motorcycle accident.
New questions tonight about the accuracy of the state's coronavirus death numbers. Orange County Health Officer Dr. Raul Pino telling us one person reported to have died from COVID was killed in a motorcycle accident. So was it removed from the data?
I don't think so. I have to double check. We were arguing. We were discussing and trying to argue with the state, not because of the numbers. I mean, it's 100. It's not make any difference if it's 99. Yeah. But the validity that the fact that the individual didn't die from COVID-19, died in a crash. But you can actually argue that it could have been the COVID-19 that caused him to crash. So I don't know the conclusion of that one.
We looked into it, and there are still 2 people in their 20s on Orange County's data list for COVID deaths. So is this a contradiction to how the state says it's counting deaths? The Florida Department of Health sending Fox 35 a statement saying a COVID death is determined if COVID-19 is listed as the immediate or underlying cause of death or listed as one of the significant conditions contributing to death, or if there's a confirmed COVID-19 infection from a lab test and the cause of death doesn't meet exclusion criteria like trauma, suicide, homicide, overdose, motor vehicle accident, etc.
The only thing that I could say to people is that the data that I'm providing you with is the data that we consume from the state, and we are offering you to the best data that we have.
And Dr. Pino tells us that the medical examiner's office has to sign off on all COVID-19 deaths. We also reached out to that office and have not heard back. Reporting live in Orlando, Danielle Lama, Fox 35 News.
Coroner in Colorado is speaking out, claiming states across the country are inflating their numbers of COVID deaths. One American News spoke with that coroner. Take a listen.
As the number of coronavirus deaths continue to grow, one coroner says many of the deaths listed are not from COVID at all. Brenda Bach, a coroner in Grand County, Colorado, says her jurisdiction lists 5 coronavirus deaths. But as Bach tells One American News, what the data does not reveal is that 2 of the victims actually died of gunshot wounds.
They were actually gunshot wounds, and the people had tested earlier in the month for COVID. And because they did have COVID, our state health department is listing them as COVID deaths.
She says it's absurd they were listed as COVID deaths, noting inflating the data will only hurt communities as it will drive away visitors and instill fear in residents.
When you start jacking up the numbers for death rates, then they're going to start closing counties down.
And Bach says this isn't just a statewide issue.
I think this is something that's happened nationwide. I've heard back from coroners in other states that they're doing the same thing, even like with motor vehicle accidents. If the people had tested within 30 days of COVID, they're listing them as COVID deaths. And it's not right.
Misreporting a person's cause of death can also bring up challenges for the victim's family. As Bach explains, it can change the amount their life insurance provider is obligated to pay to the victim's spouse and or children.
But if you die in a motor vehicle accident, that's considered an accident. A COVID death is considered a natural death. And when if you have a life insurance policy that pays double indemnity on an accident, they normally would pay double indemnity on a motor vehicle accident, but when it is classified as a COVID death, that's a natural death. And so you have attorneys and insurance companies that are now disputing the deaths.
Meantime, states across the country are reimposing lockdown orders, citing this rising number of COVID cases. Now, Bach is urging others in her position to step forward and speak up in hopes of bringing awareness to this issue.
I think more coroners just need to step up to the plate and talk about this.
The Armstrong County Coroner's Office claims the state's Department of Health is not being honest with its coronavirus death reports. The office wrote about it on Facebook after it says it made several calls to the Department of Health to correct the inconsistencies, but the calls fell on deaf ears. The Department of Health previously had on its website 6 people in Armstrong County died due to COVID-19, but the coroner's office says the number is incorrect. The office wrote on Facebook, quote, "As to the motives behind inflating the numbers, I haven't a clue. However, I am positive that other counties are in the same position." The State Department of Health has since changed the number of deaths due to COVID-19 in Armstrong County to 2. Katie Johnston for KDKA News.
All right, thanks, Trent. Researchers around the world are working right now to better understand the novel coronavirus.
Here in Northeast Ohio, doctors focused on how to tell the cause of death for an infected patient. Jesse Schultz here to break down the findings this morning. And Jesse, the results should help the medical community.
Yeah, the study involved 2 doctors from the Cleveland Clinic, and it showed that it is possible to determine if a patient died from COVID-19 or just with COVID-19 in their system. The study looked at 2 cases. The first was a 77-year-old man who had high blood pressure, arthritis, and other issues. He experienced fever, chills, and shortness of breath. The second case was a 42-year-old man who had muscular dystrophy. Both died at hospitals after going into cardiac arrest, and both autopsies showed they had COVID-19. The 77-year-old man, though, had severe damage to his lungs, and his death was, in fact, coronavirus. But the 42-year-old man did not have damage to his lungs, and the study found he died of his other medical conditions.
Remember, many of these patients have very severe diseases underlying to begin with: heart disease, kidney disease, lung disease, and they could die of those causes too. Just because they have COVID doesn't mean that the COVID is killing them.
Yeah, and just like that doctor said, the study shows that patients can die from COVID-19 or also die from other underlying medical conditions. It also shows just how careful healthcare professionals have to be, because neither of those patients had a positive confirmed case of the virus prior to their death. Live in Cleveland, Jesse Schultz, News 5.
Well, it's no secret, analyzing coronavirus data is no easy task for health officials.
Dauphin County Coroner Graham Hetrick says he has encountered challenges tracking and reporting coronavirus deaths. More from WGAL News 8's Jeremy Jenkins.
As of Monday, the state is reporting that over 4,000 people have died from the coronavirus. But Coroner Graham Hetrick says that may not be 100% accurate.
Hetrick tells me there's difficulty determining if the cause of death truly is COVID-19 because of the fact that there could be underlying health conditions.
Was it the fact that he had emphysema and was still smoking and had hypertension? All these other things that just happened to have COVID.
He says autopsies can make the determination, but they are not performed after every death.
You can't autopsy everyone. That's a really expensive thing.
Hetrick applauds the work of Dr. Rachel Levine, but he says more can be done for the public than being told to stay home.
It's not a question of whether you're going to die. That's certain. It's whether you're really going to live.
In Dauphin County, Jeremy Jenkins, WGAL News 8.